Spinal Truth Weekly Podcast Edition. I am your host, Dr. Caleb Slater, here with Chris, our color commentary and audiovisual guru. And
every week it's different. Every week I'm something new. And Jill, what are you this week?
And we're here with Jill, our social media expert.
There you go.
So this week we're going to cover what's wrong with the healthcare system, what's wrong with the medical treatment that you're getting, and I feel like this is a broad topic that could be multiple segments. So we're just going to dive into maybe the mechanics of getting an appointment, scheduling, that process. And Chris, you're relatively young still.
Oh, I'm very young, yes. Full of life, a road ahead of me, yes.
Have you been to the doctor recently?
I do go to the doctor regularly I have glaucoma, which is stupid because I am young for that. So I have to go check it.
Well, you have old eyes.
I have old eyes, an old soul. But I have to go every 6 months for that. So there's one thing that I have to regularly go to the doctor for. But then other than that, I usually only go for my yearly checkup, which is something I do, and to the dentist and things like that.
Probably take your kids to the doctors maybe more than...
Take my kids to the doctors, yes.
What's been your impression with the healthcare system with your doctor's visits? What? Good, bad, quick, long, like what?
Yeah, quick, definitely. So when I do a yearly checkup, I will come with some things that I want to talk about with the doctor that I'm struggling with or I think I need help with. And it feels like I'm always seeing someone I've never seen before.
Okay.
And I have no relationship with them. And I'm seeing the nurse who comes in and sets me up, who rooms me, longer than I am seeing the actual doctor.
Okay, so you actually bring up a few good points, and these points I actually write in the book. I have two separate chapters in my book about what's wrong with the healthcare system, right? Mm-hmm. And one thing I talk about is that the person that you spend more time with is typically the medical assistant, right? Yeah. So it's not even a nurse or nurse practitioner, it's a medical assistant. So minimal education, schooling. Mm-hmm. They bring you back. They normally don't say hi or introduce themselves. Like, who are you? Mm-hmm. Who are you to ask me my height, weight, medication, symptoms, stuff like that? Yeah. They're some of the least skilled medical workers. They're not a nurse practitioner. Sure. They're not an MD. And they're just getting your information down so that the doctor can review it without talking to you. So the doctor can run as quick and as efficient as possible. That's what they're there for, right? They're basically the pre-doctor. Yeah. But this is bad because they're taking your vital information. They're taking your heart rate, your blood pressure, your medication, your temperature. They're asking you questions on how you're feeling. The questions that the doctor should know and be processing. And there's a big difference in reading it off of a chart or reading it off of a screen than hearing it from you. Your tone of voice, the way you're sitting, the little things that you say about it. Really
whisper down the lane.
It is. Point, yeah. And then what happens is then your doctor comes in the room, and instead of and they ask you pretty much these same questions, but they're staring at the screen the whole time, reading the answers. Yeah. So they're not even listening to your response. Yeah. So that's annoying.
Yeah, it is.
And then the other one is how in and out they are, how quick they are, and how much they're able to remember from the last time they saw you. So, again, another thing I write in my book, and Jill, if you have your calculator on your phone, if you want to grab it, how I'm gonna ask you guys these questions to see if we can get to the answer. So, how many patients does your doctor see a day, a week, a month? How many patients does your doctor see until they see you again for a problem? So let's say you had a problem, mm-hmm. and it wasn't just in your yearly review, yearly checkup, you had to go back, mm-hmm. okay? So how long until you would go back to the doctor? They are gonna send you for some imaging, they're gonna send you for some blood work, some form of test, and then you're probably gonna go back to review the results with them. How long until you go back?
I would guess maybe 2 to 3 months.
Okay. So let's put it on the short end of it, okay? And let's say 6 to 8 weeks. Okay. Let's say 6 weeks. So I want to give the doctor the benefit of the doubt. Yeah. Month and a half, 6 weeks. All right. How many patients does your doctor see per hour?
4, 3 to 4 probably, I would guess.
And I think that's probably a pretty good number, right? Let's go with 3. Okay. So if they're seeing 3 an hour, they see 1 every 20 minutes. Yeah. All right. But there's documentation time. They're looking stuff up, which is something we're going to talk about too. They are communicating with their medical assistants, they're communicating with the front office, they're ordering scripts, they're getting lunch, going to the bathroom. Like there's some, paperwork time in there. So because they're not spending all those 20 minutes with you.
Yeah.
Right? All right, so let's say they see 3 an hour, and let's say they work an 8-hour day. All right, so 3 an hour times 8 is 24, times 5 is 120, right? You can just check my math, Jill. So now we're going to times that by 6 weeks.
Okay.
Okay, so that's 720 people that they've seen before they see you again for your problem.
Yeah.
How well do you think they remember your problem? How well do you think they remember your condition, your concerns?
They don't recognize me at all.
Not at all, right? Yeah. And that's if you see the same person, which is great that you brought that up, because that all hinders on you seeing the same person. So 720 people, if they only see 3 people an hour and they see you in 6 weeks, which you put it out a lot further than that. So if that's the case, and you end up seeing the same person, they've seen 720 people in that time, they don't remember your condition. They don't remember your symptoms. They don't remember your concerns. You are a brand new person to them.
Yeah, I mean, on the other side of that, my girlfriend works at a doctor's office. She's a population health expert or something like that. So she's not a medical assistant. But when they do have many recurring older patients. That's, I think, the patients they get to know and remember is the retired, 60 to 85-year-olds who are there almost weekly.
You have a lot of patients that come in for like diabetic checks.
Right, diabetic checks. And so they learn because they're there so frequently. But the younger, more healthier people, it's just like a new person every time.
Which, let's put that anybody under 60, 65.
Pretty much, yeah.
Right?
Yeah.
So which is most of the population.
Most of the population. So then it comes down to, well, how effective are their documentation of patients? Not that effective.
Oh, not effective at all.
Yeah.
There is a whole bunch of error in the documentation, and it ranges anything from inter-rater reliability, so that's from in between one physician to the other, right? Your ability to read and interpret what they said and meant, and take it into context. And then there's also the ability to find, locate it, or transfer between systems. So if you're going from, let's say, your primary care doctor to your ortho, or to your rheumatologist, to your neurologist, they probably don't share the same system. They almost definitely don't share the same system. So in order to get what your primary doctor did with the blood work, and get it over to your orthopedic who ordered your imaging, and get it over to your rheumatologist who ordered different blood work, they will all do separate things. They will not see each other's work. They will not build off of each other's work. And it basically gets lost in the shuffle. And so it's almost work that's done often for naught.
And I bet almost everyone has this experience. You go, you get put in the room, and you're waiting. The nurse already takes your height and weight and all that stuff. They type stuff on the computer, they leave, and you're waiting. And you hear when the doctor shambles up to the door, grabs the chart from outside the door, is looking at it, and then the door opens.
Yeah.
And that's how much time they reviewed you before coming in and speaking with you.
Before coming in. And they made, especially, and this is something I write about too, is they made a preconceived notion, judgment, diagnosis off of what they read in your chart or what they saw in your imaging or your blood work. They already went in having a certain thought, and that thought probably rarely changes. Rarely changes from what they had already thought reading you on a page versus what you're saying and telling them.
Yeah.
If you'd like an appointment, go to thespinaltruth.com and schedule today. We offer both in-person and telehealth appointments, and unlike the medical system, we look to the root of your problem. We look to find the cause, the why your problem, your symptoms are there in the first place, and we expect quick improvement. We expect improvement in pain, range of motion, or strength in the first visit, and 50% or more improvement in most conditions within 4 to 5 sessions. So if you're tired of being in pain, if you're tired of the medical system and its approach failing you, and you want something different, go to thespinaltruth.com and schedule today. Now let's get back to the show.
This isn't out of malpractice. I'm assuming this is not how they want treatment to be.
No, they don't, and this isn't how it was too. So, and I write this in the book too. I am not against doctors. Doctors are great people, some of our best and brightest, who sacrificed a lot of their earlier life to dedicate to school and to learning the body and its interworkings. They didn't go out and party as much in college. They did things right. They got good grades in school. They worked hard in college. They care about, at very least, what they're doing, if not who they're doing it for, you, the patient. But a bad system can take down a good doctor. And that's what we're left with right now. You are left with a system that slowly has eroded over time to make the doctor see more patients and give the doctor less time to come up with a diagnosis that could use a treatment that takes time, right? Because right now the treatments are largely what? Medication,
yeah.
Right? I mean, I would put it at 98% of the time it's medication.
Yeah, I mean, especially if you're going for some sort of symptoms you're having. If you're going and you're like, I want to lose weight, sure, they might give you
now it's Ozempic. Now it's medication.
Sure, that's true.
Right.
I really need to go to the doctor.
Right.
But yeah.
So even weight loss, and not even recently.
It's true, I didn't think about Ozempic.
What was it FinFin?
Yeah,
for a little
that
while.
Whole thing.
But anyway, so there's been weight loss medication since, I don't know, the 80s, 90s?
Yeah, at least. I mean, you have like all those fad diets and...
Well, and before that, it was speed.
Yeah.
Literally speed. My grandma always tells a story, and so this is going to be kind of wild, where she was pregnant and she was working at the time. And I mean, you have to put this in context. We're now probably talking about 75 years ago.
Yeah.
So you're talking in the 50s, maybe late 40s. I don't know how old grandma is or was during this time. And at the time it was taboo to show, especially for a working woman. So she was really nervous about this.
That's crazy.
That's crazy.
Right. So she went to her doctor and is there anything I can do about this? And he prescribed her, or maybe she was taking, what was like kind of the over-counter speed? Help me out here.
They still, isn't it for like ADHD and starts with A? Am I thinking?
It's not Adderall, no.
Oh, okay, then I'm thinking Ritalin.
No, this is before that. But anyway, she was taking some form of uppers for weight loss. It was diet pills, whatever. Joe, look it up. What were diet pills? It's blanking.
From like the 60s or 50s.
From the 60s.
And this was a woman that was pregnant.
And he said, yeah, it was fine.
That's crazy.
There's Abitrol?
No. This is kind of a generic term. You'd recognize the name.
Was it like some sort of amphetamine or something?
Yes. But so the doctor said, sure. And we've come a long way, and I forget how we got on grandma.
Yeah.
Smoking actually used to be
a dietary,
heralded as, to soothe your throat. That's where menthols came from, right? It was weight loss, stress reduction, and soothe your throat. And it was doctor recommended. Doctors used to recommend this for stress reduction, for throat, a throat balm, right? And we keep evolving over time.
Yeah.
But with that evolution, we really haven't we've gotten away from anything other than medication as the solution. Medication, injections, pills, whatever, as the solution. And because you really only write a script, that treatment doesn't take a lot of time. And because we want to make more money, we've jammed more patients in. And because we've jammed more patients in, you don't have the option to root around, to ask a bunch of questions, to follow up, right? You won't make money that way.
Won't make money that way. Also, unfortunately, if you are putting the onus on the patient to take matters into their own hands and perform exercises and put work into something, how many people are going to do that?
Well, that's harder too. And it's also harder to have that candid conversation with a patient. Like, look, your cholesterol's up, your anxiety's up. You need to lose weight, exercise. You need to go out, be healthy. You need to eat right, get some sun, turn your screen off, right? Yeah. You need to read, decompress. You need to get some face-to-face time with a real person. There's a...
I feel heard right now.
There's a TikTok trend that I've seen, like, it's somebody complaining like, oh, I'm stressed, and then you hear a voice going, well, have you drank any water? No. Did you limit your caffeine? No. Have you gotten outside today? No. Any sun? No. Have you stayed off the internet? No. Have you gotten good enough sleep? Yep. Oh, that one I've done. No, it is true. It's not always
It's the lifestyle we live in right now. A lot of people live in.
We want the quick solution. So, and again, it's not even necessarily the doctors and the system's fault. It's society's fault for wanting that quick fix. Which again, if taking a pill made me smarter, stronger, quicker, right, or took all the pain away and the cause of the pain away, sign me up. Let's go.
Yeah, with no side effects. Because I'm pretty sure like fentanyl will do that temporarily, but that's not a solution to a lot of problems.
Right.
You know what I mean? We're talking about like something that actually is effective and not just a Band-Aid
The benefits outweigh the negatives.
Yeah, exactly.
Side effects, right.
And so if you bring it down to the basics of like exercise, good sleep, and good diet, all that stuff anyone can achieve, but
And
it's not easy.
if that's the cause too, if it's that you're not eating the right stuff, if you're doing that and now you're changing your diet and you're still having those problems, obviously that wasn't the fix in the first place.
And
which
just
is,
what I was about to say,
True.
Jill.
Yeah.
You took the words right out of my mouth. This is worth trying at first.
Yeah.
Right? This is worth the doctor having the conversation, and maybe it is 9 times out of 10, if not more, going to be a failed conversation, because then the onus is on the patient, but at least they tried. But I think they've realized that it hasn't worked, and now we just rely on medication. But why not still say, hey, look, here's your, we'll call it holistic options. Here are your options that you can try to see if you can move the needle in any direction for your pain, for your anxiety, for your stress, for your energy level, whatever. A lot of the conditions and symptoms out there that can be treated holistically, right? And if it doesn't work, then we can go the medication route. Or you can even do the opposite. You could say, look, here's the medication that will help get you to where you need to be, where you don't need the medication anymore. And I saw actually somebody posted, we had a post recently that is almost at 1 million views. It really kind of hit home with a lot of people, and it was along these lines of, you know, doctors will see you for 4 minutes, they'll give you medication that doesn't treat any of your underlying cause, and they call that medicine, right? And a lot of people really responded, reaching out, you know, saying, you know, true, and thank you for saying this and stuff like that. So they're feeling the same issues. But somebody said, when's the last time a doctor gave you a medication and gave you plans on getting off of it?
Yeah.
Right? And I thought that was great, because it doesn't. The plan is keep taking it until it doesn't work, and then we'll give you a different medication or more of the same medication. So I tell this to a lot of patients, you know, about getting, you know, epidural or facet injection, cortisone, stuff like that. It doesn't treat the underlying cause. It just masks your symptoms. Now, there's nothing wrong with that. There's nothing wrong with getting your symptoms managed. I don't want to be in pain. No. I also need to live my life. I need to pick up my kids and do housework and go to work, right? I need to be able to do those things, and I want to be able to enjoy myself and not be in, you know, detracting pain. So great. So taking the pill, getting the injection, that's okay. But what are you doing to not need that medication when it ultimately wears off? What are you doing to get yourself, your body, to the right state where you're no longer symptomatic when that temporary treatment wears off? Nothing, right? For most
nothing.
people.
Well, and it's interesting too, like I've had a few friends who, you know, they say they have depression, anxiety, whatever, they go to the doctor gives them some sort of medication, and now they don't necessarily feel like they have anxiety or depression, but then they don't really feel anything. And they kind of give you these fixes where maybe it fixed one problem, but now it just added 5 more to the list that you started with, and it's like, well now I'd almost
you go
rather...
back to the doctor for one of those 5, right? The most prolific one, and guess what the answer is going to be? Another medication, right? Or changing the medication that they gave you for the first one, right? But either way, it's messing with medication. So that is a glaring problem in the medical system right now.
So where does this all stem from? Why are we a factory line of
Money,
patients
time.
through?
I mean, there you go. Money and time, right? Money, time, effort. So it's not one thing, which is what makes it so hard to defeat, right? To combat. It's if everybody out there said, okay, fine, we're going to fix this, but now it's a 45-minute session with your doctor. They're going to go over everything. You're going to have to pay more for it, and the onus is going to be put back on you for a lot of things. To, you know, you're going to have to write down your symptoms. You're going to have to have a plan, which is going to involve some form of, you know, changing your diet, changing your exercise, your activity level, getting sun, drinking more water, whatever it is, whatever the solution is. And then you're going to go back to the doctor and revisit this and see if it's changed. You know, I bet you a lot of people are out already.
Give me the Ozempic.
Right, there you go. There you go. So it's because it takes effort, it takes time,
Yeah.
it takes money, and not only that, but the medical system already doesn't want that because you're not going to be able to 45-minute appointment, an hour appointment, right? If you're not going to get people to pay triple.
So I've heard of some doctors who now have like a retainer fee.
It's like a concierge doctor kind of thing. Yeah,
Yeah.
it's actually becoming more and more common. So you pay something like, let's say, $5,000 a year, something
Yeah.
like that, right? And the doctor only has a certain number of people on their book.
Yeah.
Right. Let's just say 100. So they'll only take 100, so that way they can give those 100 more
Proper
attention,
care, yeah,
right? Proper care, and they charge you a
Premium, yeah.
retaining premium. Yeah.
Which is great if you can afford something like that to get that private, like, then you would think the doctor would intimately know your details and be aware of your symptoms and whatever issues you are having. And so the care is probably better and more appropriate and not so generalized. But
Well, you say that, and I agree, you're going to get more face time, you're going
Yeah.
to be heard more, you're going to feel heard more. But
it's the same treatment.
it's the same treatment, exactly.
Yeah.
It's the exact same treatment. And we talk about this too. You think the athletes out there, so let's say the NFL, the Major League Baseball player, NBA, stuff like that, you think that these athletes are getting the creme de la creme of treatment, right? They're not. They're just getting it quicker, sooner,
yeah.
right? They're getting more of it, but they're getting the same treatment.
So what does the role of insurance play into this?
Insurance has deteriorated the medical system. It probably single-handedly is the worst thing for the medical system that's existed. And I write this in the book. What do you think insurance does for you?
Oh, I know it does nothing. It's just a middleman.
But it's a middleman. But it's a middleman for both sides.
Yeah.
Right. But it's a middleman playing both sides. Not for both sides, playing both sides. Right. Because let's say the insurance is supposed to exist so that if I have a serious problem, the cost is minimized to me, right? And in that, because I pay a monthly premium, that if I need, we'll call it normal maintenance care, evaluation, or stuff like that, that cost is also mitigated. Okay, right now, and I literally write this in the book, in 2022, when I was writing the book, I was 38 years old, healthy, 37-year-old wife, healthy, 2 children, 9 and 7, both healthy, thankfully. What do you think I paid for a year of health insurance?
For a year?
1 year.
$15,000?
$19,000.
Okay.
And I own my own business, so I actually get about $2,000 off. So I paid $1,557 a month for health insurance.
Yeah, that sounds right.
Okay, that's a mortgage.
Oh, yeah.
Okay.
Not in this time, but yeah. Now
I mean, it's a I think it's a mortgage.
It's a lot.
Depends on your insurance rates when you go.
Yeah.
But anyway, it's a lot, right? I rarely use it, and when I do use it, I still have a copay, co-insurance,
Yep.
deductible, something like
Yep.
that. So what the hell is the insurance doing for me? And fine. So let's say I pay all this money. At the very least, if I have a bad accident or something like that, or a disease that takes a lot of treatments, it's there, okay. And if it helps get me the best treatment possible, then maybe then I'm all right with it. I won't bitch, okay?
Yeah.
But it doesn't. It actually diminishes the amount of treatment that you can get by a lot, all right? It minimizes who can see you, how often they can see you, what they can do for you when they do see you, right? And it
dictates your care.
It dictates your care. So do you know what what's it called? When the doctors, basically you are capitated. You know what a capitation is?
No.
If you're out there and you're in pain, if you're tired of the current medical system failing you over and over and over again, just giving you answers that numb you, pacify you to your symptoms, and are largely based on medication, injections, and surgery, and you want a different way, maybe even a better way, look for my book, The Spinal Truth, A New World of Medicine. In it, each chapter I talk about a different symptom, different condition, different body part, and how I view it a little bit differently than the current medical system, and how my treatment has helped so many people out there when they've been let down with the typical approach. This is the way I think medicine should be. This is the change in healthcare I think we deserve. So thespinaltruth.com, you can look for my book on Amazon, Kindle, Apple, and on audio.
So capitation is your doctor gets capitated in a certain area with a certain, let's just say like under Aetna or Blue Cross Blue Shield, something like that, right? So in a certain region, if you have Aetna, this is going to be your primary care doctor.
Okay.
All right, so the doctor gets paid not per session visit or whatever, but per person living in that area who has that insurance. Already, what do you think that does to that doctor's care?
So
He's not paid for when you come in, he's just paid that you exist in that area.
yeah, so he doesn't care.
He doesn't care, and he's kind of incentivized to not see you as often,
Yeah.
right?
Yeah.
To not see you as often, as many times, as long, right?
Yeah.
Okay, and what that does too is that because let's say you have Aetna and you're living in this certain area, you have to go and see this doctor. Well, that's your primary. There's an ortho in that capitation. There's a rheumatologist in that capitation. Let's say you need a cardiac workup, right? So there's something wrong with your heart, okay? I mean, there probably is.
Wow. Yeah.
Now, let's say you want to go to the cardiologist. You want to go to the best cardiologist, right?
Yeah.
And the best cardiologist might mean one that your doctor knows in the area, has worked well with, can communicate well with, or depending on how many times you need to go, it might mean the person that lives relatively close to your house, right? Or practices closest to your house, not 6 hours away if you have to go back and forth 7 times over the next 2 months, okay? There's a lot of factors that go into it. But because of the insurance, the only factor that goes into it is who's capitated in that plan. You can go to that person that your doctor picks. Same thing for physical therapists, same thing for chiropractors, right? So not only do they charge you a premium, insurance companies, and keep charging you as you go, but they limit who you can see, and then they limit what that person can do for you. So that person, your doctor is going to want to order an X-ray, an MRI, blood tests, whatever. Okay, well, I wanted certain blood tests recently. I wanted kind of a full workup of some non-traditional lab work, right? And because I was curious, I'm starting to like get into this, looking at my own blood work and stuff like that. I had to pay extra out of pocket because insurance wouldn't cover it. Okay, fine. But the doctors were kind of leery about ordering that test too, because I'm sure they get, slapped, their hand gets slapped when they order certain things. Same thing with like ordering X-rays and MRIs and CT scans. There's only really like a certain amount that they can order before they're going to start getting flagged. Okay? Not only that, they're going to get denied. Okay? So let's say you had a car accident. Mm-hmm. And this might not be the best analogy or situation, but let's say you have irretractable back pain. Mm-hmm. Your doctor wants to order an MRI to see what's going on. Mm-hmm. Let's say you had no car accident, you had no fall, nothing like that. So we're not thinking there's a fracture. Basically, an X-ray is not going to help.
Okay.
The insurance company is going to say, you can't get an MRI, he has to go through these steps first. And it's very likely going to be getting an X-ray. Yep. And it's very likely going to be having maybe even some treatment first, which could be an injection or something like physical therapy. So the insurance company is going to say, you have to try this first before you get this. And your doctor is saying, we need this. So now you go through the steps, you get your X-ray, and that nobody thought the X-ray was going to show anything, right? Yeah. So it just wasted your time, your money. It wasted wasted healthcare's time and money, right? And it was an unnecessary exposure to radiation. Not a lot of radiation, but still unnecessary, right? Then they're going to say, all right, well, you need to go to physical therapy, but they're going to say you need to fail physical therapy. Okay, and they literally use that term. You need to fail physical therapy. So your doctor tells you this, you're going to say, what does fail physical therapy mean? Well, it can mean anything from going to 1, maybe 2 visits, and saying it didn't work. Now you can check that off, send it to the insurance, right? So we'll actually get people that they'll call up and they'll say, I need this for my insurance. I need this in order to get an MRI. I need this in order to get surgery. So they really only come in for the 1-2 visits, and then they say,
it failed,
failed physical therapy, right?
That's also scary as a patient for what if you try physical therapy and it possibly works after 3 to 4 visits, but you only go 1 to 2 times to just write it off, and now you get a surgery that you don't really need?
But they're getting told this by their doctor too, right?
Right.
They're getting told that you need this surgery.
And you trust them as the medical
trust them as the
professional.
medical
I didn't go to
professional.
8 years of doctor school. I
Right.
don't know what to do.
Right. So you trust them, and you should have some trust and faith. But I think now you're seeing, and this is the response that we got. You have to be your own advocate. You have to do your own research. But it takes some time and energy and some know-how and some persistence and to be able to do that for yourself. And not everybody can or has the education to be able to do that. Like I couldn't be my own advocate for computer software update, right?
Yeah.
Like I couldn't. It just to work on my computer, that I wouldn't be able to do it. I'd have to put in a lot of time and effort. I would fail a lot. It's not going to work for me. Okay, and there's people out there that have that same inability for their healthcare.
So, okay, so as a patient, I have a copay. Say it's $40 to see the doctor. So what is the doctor getting out of the $40 that I'm paying?
It depends. So it depends on the procedure that they do. So let's just say, for example, it's a regular checkup.
Yeah.
They're probably getting, I honestly, I don't know the numbers, but they're probably getting somewhere around, they're getting a good amount on top of that.
Okay.
Okay, so the insurance, that you have to pay that copay, that's just basically the insurance company saying you have to help out with what we're going to do.
Yeah.
You're probably paying 20%, 30% of it.
But for me, right now, rarely going to the doctor, it's almost like I'll pay $120 to see the doctor if I don't have to pay $400 a month.
Right. So why does the insurance exist, or why is it so expensive? And it's because when it started, the insurance company would reimburse pretty well. Okay. And so let's say you had a $100 procedure, the insurance company would reimburse the doctor $100. But then they started saying like, well, we're really only going to reimburse you $90. So what'd the doctor do?
Raise the price.
Raise the price. So now that procedure costs $110.
So it's just a game that keeps going
It's
up
a
and up.
game. And this has literally happened to me, and I'm a little hesitant to say it, on social media. But my wife needed, I think it was an MRI. She had a bad fall. Not that that's funny. It's just she had a bad fall. This was a long time ago, and she needed an imaging of her spine. So we called and I gave them my insurance, and then they said it was going to be $800 because we had a deductible or something like that. And I said, well, what if you don't have insurance? And they said, it's $100. And I'm like, well, I want that one. And they said, no, you have insurance, you have to do this. And I said, okay, I'll think about it. Hung up. Called back. And then I'm like, hey, my wife needs an MRI, but we don't have insurance. Okay, it's $100. So again, the insurance company has raised these prices, right, because they reimburse less. But if we just didn't play that game from the beginning, it would cost a reasonable price. The doctor would be able to charge a reasonable price. You'd be able to pay that reasonable price. So we've artificially raised these prices, and everybody knows it. So like we submit a bill, and if you read our bill, I forget what it would say. I try not to look and think about it often, but like it looks like we're getting a ton of money from what we build out, but it's not. We get a fraction of that. We get 30, 40% of what we bill out.
And it's a game that only benefits the insurance companies to keep making profits at the expense of patients whose costs keep getting inflated for the same care.
And remember too, so you pay the insurance company for healthcare, okay? But the insurance company then pays the doctors to give you that healthcare.
Yeah.
So if they pay the doctors more than you pay them, they lose money.
Yeah.
So the only way they make money is if they limit your ability to get health care. It's a literal contradiction of why you're paying them in the first place.
That's why you can get into that cycle of just back and forth.
And most people, I think, know this, but they don't know this.
Well,
right?
I think it's because there's no option. You have no other option.
There's no other option. It would take a lot of people banding together, right?
Well, like you said too before, like if I got into some car accident, like I wouldn't just call my insurance and be like, hey, if I got into this car accident and have 3 broken bones, how much is it with and without insurance? Like, you don't really know until something happens, and then it's like...
And I understand having
You know?
that umbrella for trauma, right? For, they found a tumor, you were in a bad car accident, something, right? Like, that makes sense. But it's the fact that they mess with all of your other treatments. And it's the fact that it's, and again, I don't mind paying my due. I really don't. Like, I don't mind paying, and I would pay more for better service. It's the fact that you can't really pay more for better service, better treatment, better options. It's you pay a bunch of money and they give you worse treatment for it. I got away from insurances. I got away from taking insurances. I'm able to see my patients for an hour a visit. I'm able to give them my one-on-one attention, but you can't really scale that business, right? It's harder to scale that business anyway. It's harder to find people that want to pay outside of their pocket. It's the same as paying for private school when you're already paying school taxes for public school, right? Like, you have 2 kids, I have 2 kids.
Yeah.
It's hard to eat paying a lot of money for school when you're already paying money for school. It's hard to pay more for healthcare when you're already paying a lot for healthcare.
Yeah. Yeah, I mean, you said it, you have to have that kind of income level where you are able to just say, yeah, I can afford this. Because being limited by insurance, like, I think about that cost. I'm like, well, I'm already paying $400 a month, so I'm not going to go and pay additional on top of that just because.
Well, and you have to know that there's also different treatment out there too,
True.
and you have to trust that treatment. So, and I
Yeah.
think that's really why I exist, why we exist right now. We're trying to show the world that there's a different option for a lot of your symptoms, for a lot of your general joint pain, your knee, your hip, your foot, your ankle, your elbow, your shoulder, right? For your headaches, for your anxiety, your energy levels, for your brain fog, for your IBS and Crohn's. There's other options that at the very least are worth exploring because they don't come with side effects. They do try to get at the root cause. And if they work, you are actually better, not just managed, not just numbed, not just masked, actually better.
Yeah, not on a pill.
Not on a pill. So I think that's a good stopping point for this part of the show. I would like to get into the treatments themselves, as well as some of the evaluative tools, the x-rays, MRIs, stuff like that. What are the problems with that? We also have to talk about what are some of the downfalls or pitfalls of other healthcare providers like physical therapists, chiropractors, and I think that's a good topic for next week's show. So thank you for watching. Thank you for listening to the Spinal Truth Weekly Podcast Edition. Hopefully we answered a lot of your questions. Hopefully we informed you a lot about your healthcare system and maybe gave you a different look or maybe just highlighted something that you already knew. But if you have a question that we didn't answer, please feel free to write in. You can leave a comment below. You can reach out to us on TikTok, Instagram, Facebook. We are here to give you a different perspective and hopefully make change in the healthcare system that's much needed. We will see you next week where we'll continue this topic and talk a little bit more about the actual medication, the treatments themselves.